Hello, my name is Dr. Dan Chaskin Podiatrist, and I'm here to talk today about dermoscopy and the dermatoscope that I use, a Dermlight 4 dermatoscope, which has a high degree of polarization, and you could see that it has a very wide field, so you could probably take the entire lesion and get it into the view of the entire wide field. Its field is quite large, and it also has an ice cap, which is detachable, comes off, and it is for basically infection control purposes. And you also have polarized and non-polarized lights, and the polarized lights have such a high degree of polarization you are able to sometimes see much better, especially when you're dealing with amelanonic melanoma. You have these polymorphic type vessels. Any vessel that's atypical, that's not a comma type vessel, is very difficult to tell on a nodular lesion such as an amelanonic melanoma, if at all. So why not use the most advanced technology out there in terms of using a dermatoscope with very high polarization? This Dermlight 4 is quite good. I use two other dermatoscopes, and the Dermlight 4, I don't know what I'd do without it. As far as dermoscopy itself, I did say that I would talk about the basal cell carcinoma, for which you have leaf-like structures, and sometimes the arborizing vessels that you see are very difficult. So why not use a Dermlight 4 to try to detect them? As far as any blue or brown, I believe they're non-aggregated globules that might be present. You have sometimes spoke wheels, which sometimes are very difficult to tell, but if you are able to see spoke wheel structures, you're way ahead of the game when you use a dermatoscope that has high polarization with the ability to toggle between non-polarized and polarized modes. Shiny white structures you could tell in a basal cell carcinoma when you actually use your polarized mode. Collagen is present. Since you're using polarized mode, you basically get deeper structures in the dermis. You tend to see collagen better when you use the polarized mode. You also have a situation where everyone knows about, or most people out there that are podiatrists know about, the seborrheic keratosis. We have the comedones and miliocysts, relatively benign areas, the whole slew of other structures. But what about if you want to detect something like hairpin vessels? Why not use a dermatoscope with high polarization that's non-contact to see if the hairpin vessels have a whitish halo, or if they have a more ominous reddish, okay, I believe it's milky white, actually milky red. Whenever you have something whitish surrounding a hairpin vessel, it tends to be benign. When it's milky red, it tends to be more ominous. However, what if you switch to the non-polarized mode with a toggle function, which is present in the Dermlight 4 dermatoscope? You have a seborrheic keratosis, which normally you say, hey, there's nothing wrong with it. You have the comedones present, you have the miliocysts, don't worry about it. But the non-polarized mode, you see this orthokeratosis that's present. And when you see this bluish-like veil with orthokeratosis present, you gotta biopsy the area. You biopsy it, send it to a dermatopathologist, so the dermatopathologist can then have the entire lesion, a dermoscopic picture of the lesion, take that dermoscopic picture of the lesion and accurately section that lesion for biopsy and include that as part of the dermatopathology report. Think of it this way. If you have a pseudopod, which could mean radial growth, you have a problem if you're a dermatopathologist and you don't have the dermatoscopic information that's present. You have a problem when you solely rely on the dermatoscope and ignore clinical information. You have to take dermoscopy as a tool. A lot of times when you use dermoscopy, even with a strong dermatoscope, if you have a lesion such as a pyogenic granuloma and you have a possible amelanonic melanoma present, and you're trying to look for those polymorphic vessels that are not comma vessels. Any vessel that's not a comma vessel is atypical. But if you have polymorphic vessels, they won't show up, okay, all the time, even when you use dermoscopy. So if you have this kind of a nodular lesion that's long persistent, if you have a family history of skin cancer, if you have any sort of a problem with yourself having skin cancer, why not make an error on actually going in and biopsying the area? I mean, if you have a problem where you have any diagnostic questions, a derm light for dermatoscope or anything comparable to strong polarized dermoscopy with the ability to toggle back and forth, I prefer and I love this size cap. As far as this phone, Samsung phone, it attaches to this dermatoscope to get all this view. I do not know what I would do without my Derm 4 dermatoscope. This will be continued. I have to give a standard disclaimer, which is this is a personal opinion of mine and not to be construed as any sort of podiatric medical advice. Every patient is basically under anybody else's care, and these videos only my own personal opinions on how I deal with my own personal patients. Thank you.